My name is Marisol Cabana, and I'm doing my presentation on peptic ulcer disease. 1 in 5 is related to neither Helicobacter pylori nor aspirin or NSAID intake. So the background, why the study was conducted, was based on the proportion of peptic ulcer disease that is not related to H. pylori or NSAID or aspirin, and is debated. The purpose of this study was that it's the French prospective multi-center study, and it was to analyze distribution of PUD risk factors and determine the prevalence and the clinical characteristics of idiopathic PUD. And the aim is to analyze the current epidemiological and clinical characteristics of peptic ulcer disease. The connection between exposure and disease. H. pylori infection remains a major cause of PUD, and nonsteroidal anti-inflammatory drugs and or aspirin intake is the second cause of PUD. The third group of ulcers unrelated to these risk factors has been described in various countries. Idiopathic ulcers, which is H. pylori negative and NSAID aspirin negative, and it varies 2 to 35% according to time, country, and design of different studies. Major techniques used in the study. It's a prospective observational study conducted from January 2009 to January 2010. It was conducted in 32 public hospitals, different areas of France, within rural and urban environments. The subjects were 18 and older, and they had endoscopy proven peptic ulcers of the stomach and or duodenum. Patients received written information and gave their consent to participate. Some of the data collected were based upon their gender, age, country of birth, main indication of upper gastrointestinal endoscopy. Also, data on NSAIDs, which were low dose aspirin, lower than 300 milligrams per day, high dose aspirin, which is greater than 300 milligrams per day, coxibs, corticosteroids, antibiotics, and proton pump inhibitors. And then the last 30 days were recorded of endoscopy by asking the patient's information and reviewing hospital files. The tests done were the